Welcome to A New Era of Dentistry, the ultimate podcast for uncovering the latest trends, breakthroughs, and real-life stories in the dental industry, hosted by Ashley Bond with Wisdom, along with co-host Stephanie Neville. This podcast will explore hot topics, chat with industry leaders, and share the stories that are redefining how dental professionals enhance patient care and the dental practice environment. Let's get started and reshape the future of dental care together, one episode at a time. It's that time again. It's dental drama listener submission time on A New Era of Dentistry. This is from a listener. So we'll just get started right out of the gate. I'm going to read what they sent in, and then we're going to talk it out a little bit. So this is coming from an office manager who says, not too long after they switched jobs, the owner of the practices hired a new associate who they seriously questioned if he went to dental school. He would ask assistants to walk him through root canal procedures, and not in a let me teach you or make sure you know what you're doing type of way, but more of he had no idea what he was doing type of way. That was concerning, but the thing that was most concerning was how he treated his assistants. He treated the front office team great, knowing that that's how he got a full schedule, but in the back office, he made assistants cry all the time. So the listener pulled them aside and talked to him about it, and he acted like they were all ganging up on him. And a few days go by, and this office manager had to go in after hours to help with an emergency patient. We've all been there too. And the dentist tells her in front of the patient how nice it is to have her assisting him because most assistants are worthless. So at that point, our submitter decided to speak to one of the owners about the situation and was basically told that the associate was a doctor and ranked above her. And the person then put in their 2 weeks notice. So when they put their notice in, the owners realized it was definitely coming down to the office manager versus the associate issue. And they did decide to fire this doctor. But it was too late. This person already said they refuse to work for someone who can't ensure their teams are treated well. The damage was done. And so part of our survey that's out there for all of you guys to submit your stories asks, is there anything you would have done differently or would like to share to help other people? And we have an answer on that end with this one. And they said, I wish I would have been more direct with the issue to upper management and gotten the point across without threatening to quit. I don't believe ultimatums are ever a good thing, but I also wasn't treating it as such. I was leaving either way. I will say the night the dentist got fired, they asked me to help them print off the production or collection report after the owner dentist left, and I did. We were in his office and I was showing him how, and he let me know that I was the best office manager he'd ever worked with, and it was clear I sincerely cared about my team. With that, I hope that he took that and is treating assistants better at whatever new office he's working with. So for me, there are two pieces of this. How to handle clinical ability lacking or concerns with the DDS, right? How do you handle that and report it to whoever's in charge? But more so conflict resolution, which honestly seems to be what so many of our submissions about. So let's dig into the performance piece first. I'm wondering if the assistants that were reporting this to the office manager were encouraged to actually report it to the owners with examples. That would be my first question. What are your thoughts on that, Ashley?
So blown away by the worthless comment. Wow.
That's rough.
That would have been very hard not to just walk out right then. That is very rough. What I'm thinking though is there's no way the owners didn't know. Like you can tell walking into an office the vibe of the atmosphere and how people treat people, that it is hard for me to believe that it is not something that was on their radar already. It sounds like he was pretty vocal about his thoughts when it came to his seniority, which I do believe you need to respect your practice owners, your dentists, been in an environment where there isn't that respect level. I always think you need to respect your bosses, but you also deserve respect back. And it's a two-way street there. So yeah, I wonder if it is something that they knew was brewing. I feel like they probably did. And then did the dental assistants also go? I don't know. If I was in that situation, what do you think about a whole group going, like to talk to the owners? In that situation, do you feel like instead of just the office manager putting her neck out on the line, and it obviously didn't go well, should maybe have been a group of people.
I tend to agree with that. So, like, if you tie the performance concern piece into how people are being
Yeah.
treated, it's like, well, what are the details there? Is it which file do I use for a molar, or is it how do I know if I'm at the apex? Like, what's being discussed in front of the patients repeatedly that makes other clinicians feel like their doctor doesn't know what's going on, first of all. Here's the thing, though. If the doctor's saying everybody's ganging up on them and maybe these people just don't like him, and then they're all talking to each other and they go as a group, that can kind of compound that problem.
Yeah, that's true. That can be toxic too.
Yeah, it's such a tricky thing.
And it would be hard for me clinically. Granted, I'm not a dental assistant, so I think there's something to say. Dental assistant obviously is going to know a lot more clinically than I am. I've never been staring down a tooth during a root canal procedure, thank goodness. I'm very squeamish when it comes to teeth and blood. So I don't know if I would be comfortable critiquing the performance of a dentist. That would be very difficult for me. The attitude and atmosphere is something that, to me, that is unforgivable is not the word, because I don't think there's anything that's not forgivable, but that's a whole different thing. That is hard to be fixed with training when you have that sort of attitude. Anyone that's coming in, especially if they're a newer dentist, I mean, they're not going to be like a seasoned dentist. So I think you need to have grace and training and just make sure your patients are being taken care of. But again, it's the character issues of calling people worthless. That would be hard for me to get over.
Absolutely. And while you're talking that out, I'm thinking, well, I wonder if the way people are treated makes them go towards some other excuse to get rid of this person. Like they don't know what they're doing. And I'm not insinuating that happened in any way, but what you said is true. We all have to respect our clinicians in the fact that they have a degree, a doctorate in dental, surgery. And it's really not up to us to say whether or not they're doing their job properly. I mean, if somebody's blatantly harming patients or putting people at risk, that's one thing, but I don't think I could ever be critical of how someone is doing something as a dentist or what they ask unless a patient complains. So right. I guess, putting that aside, anybody saying anybody in an office is worthless isn't good. So what would you have done differently piece of it? Like we can dive into, I think we're all, as humans, prone to be a little bit reactive when it comes to things like that. And, I'm not going to not be transparent and not say I haven't done this myself, where you get so wound up. It's like you go and you anticipate no reception to the thing changing. So you're like, blah, 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 and this is awful, so I quit. And I think that this person is conveying that they wish they wouldn't have done that. It could have been more of a, here's what's happening. Here's what I propose as a solution. Can we talk this out kind of thing?
Mm-hmm. And I'm actually going to backtrack on my answer of the whole group going in. When you hear certain words like worthless, your defenses go up. You're like, no, attack. But now that I have time to sit on it, so I think anytime you're in that situation, pause and reflect before you act. It's very important because I'm already reflecting on my answer. And I think how I would handle it is, and I try to do this when there seems to be miscommunication, that having some empathy for the other person of what are they going through, or maybe why are they coming off this way? Maybe, if they're a new dentist and they just graduated, maybe they're insecure about their dentistry. Maybe they're highly stressed. Maybe they took out, they have $500,000 in student loans and other things could be going on at home. Like maybe there is an underlying issue that if you just directly talk to the person calmly, like, hey, I overheard this. This is how it made me feel. I would like to talk about it and work through this. Like, why are you having those feelings? And maybe see where they're coming from. Because at the end of the day, if you can break through those different personalities and get to the root issues because there's something underlying there. If he's saying that, something's going on. So it's more trying to reach the person. Some people you might be able to reach and you guys can work toward a better future together of communication. I think there's some people that are just going to be closed off and aren't going to try to accept feedback. So I would maybe try to get, come in that way, being trying to understand where they're coming from and then tell them how it is making you and the team feel and see where you can go from there.
Yeah, I agree. I'm glad you backtracked, and it made me think about it more deeply too. Yeah, we do that sometimes. The more you talk about something, the
Yeah.
more you just,
Yes.
unpack it. And that reminds me of an episode that we'll be releasing here in the next few weeks that we collaborated with Brenda McNulty on, pertaining to leadership
Mm-hmm.
training in the office and those standard operating procedures. I think if you have that in writing, it would be harder for either side, dentist or assistant, to say somebody isn't doing their job properly, because if you've got
Mm-hmm.
it in writing, then everybody should be able to say, well, this isn't going well because this isn't happening in the midst of this SOP. And that is applicable to clinical
Right.
procedures too.
Very, very true. And it reminds me of the book. I don't know if you read it, The Five Dysfunctions of a Team, like a short book. It points out that it sounds like there is not trust in that group. Like there's a lack of trust. It could be, like we talked with Brenda about, maybe a doctor's pain point or pet peeve keeps occurring and it's causing him to lash out, and there's not enough trust built to give feedback, both doctor to the team and team back to the doctor. So I think underlying there might be a trust issue, and then things are festering and building, which is causing those blowups from both sides.
Yeah, absolutely. And it seems like even our submitter at the end of it was kind of circling back and thinking through all of those things too, because it sounds like they witnessed a different side of the doctor when they were both on their way out the door. So it's funny how a closure like that will calm you down enough to kind of step outside of the emotional piece of it and just look at the professional relationship and how things are working and change it around and teach you a lesson. The biggest thing for me here is don't go to anyone as a group, right? To talk about whoever's doing what.
Right. Don't do my
Yeah.
first piece of advice. Don't do that.
Yeah. And I mean, I'll backpedal a little bit too. Like in the beginning, I was leaning towards saying, yeah, absolutely. If you feel like the doctor isn't doing something well clinically, you should tell somebody. But what you said made me go, but you don't really know.
Mhm.
Yeah, I sat knee to knee for
I know.
years and years. And I've said before, if I had to sit down and prep a crown, I could do it. I can clean up a margin. But just because I think I can doesn't mean I can, because watching it be
Right.
done and
Right.
actually doing it are two
And
very,
doing
very
it
different things.
right. And I think it's important that in these situations, I'm sure we've all been there, when you do get that group mentality, especially if it's negativity, it
Mhm.
spreads. And so, if there's someone in the office you don't like and people start talking about it, in the background, every day that aura is in there, that vibe of negativity. So I highly believe that if you're wanting to vent or talk to someone, get advice from someone outside of that environment, outside of the dental practice. Maybe go to a trusted friend, advisor, mentor, see how they would handle it, because they'll be able to give you a perspective based not on, the emotions that you're feeling being in that environment. So
Mhm.
definitely don't do my first tip of going as a group. Pause and think about it like we did. Pause before you react. And I love that this team member has reflected
Mhm.
on it. It's like, hey, I would have done this a little different. And also love that she got the closure from the owner, that how great of a team member she was. I'm sure that meant a lot to her to know that I am valued. And while this didn't end the way I wanted it to, I at least know that I was appreciated. So I think that was at least a good way to end the relationship there.
Agreed. And I love the advice you just gave about seeking advice outside of the office. I've never thought to recommend that. And, that's great advice. If you can just talk to somebody, remove the dental lingo from it. It's all just personal relationships. So
Mhm.
getting that feedback
Right.
is a really good idea. And that leads me to say,
Yeah.
we have some really fantastic episodes coming up about in office relationships, leadership, coaching styles, how to get your team to move like the well oiled machine that it should be, but with, human nature considered, and We're excited to push those out, so don't miss those. And please look in the description and submit some stories. We're always accepting your stories to review on air anonymously.
Thank you all for tuning in, and we'll see you next time.
Thank you for joining us on today's journey through a new era of dentistry with your host, Ashley Bond. With wisdom in their network of industry leaders, each episode offers fresh insights and support in the evolving world of dentistry. Subscribe, stay tuned, and transform your career, practice, and patient experience. Until next time, keep innovating, keep caring, and stay smiling.